Well, COVID has certainly disrupted a lot of our lives, and including access to dental care.
Did you know that February is National Children's Dental Health Month? Here to talk more about the importance of dental care is Dr. Richard Gesker. He's the Chief Dental Officer with United Healthcare. Thank you so much for being with us. We appreciate it, Doctor.
Well, thank you for having us.
You know, with the pandemic, I think I love to go to the dentist. It might be weird for that, but I always go. And I would say with my kids and myself, a lot of people have put it off or canceled it back when, what if your appointment was in spring when everything first shut down? So a lot of folks are behind now, right?
Oh, they sure are, because early on during the pandemic, many dental offices had to, unfortunately, temporarily close. And these same people, these same patients are staying away from dental care. Other than in places where COVID-19 is spreading uncontrolled, we do not want you to skip these routine dental visits, especially for children.
Exactly.
Because by age 5, nearly 50% of all children have at least one cavity.
I go to the dentist on a regular basis. I did put it off a little bit because of COVID. And then I was like, I had a cracked tooth, doc, so I had to go. And my dentist looks like the Michelin Man. There is I feel so safe in there. It's unbelievable.
You're absolutely right. Dental offices were safe before COVID. They were safe during the temporary closure when we were limited to emergency care, and they're safe now. Dental offices are exceptional when it comes to infection control and your safety. So get back into the office, and your office will love to see you.
And some people might be saying, oh, it's just my teeth. But talk about the real link between oral health and your overall health.
Yeah, absolutely. You know, somehow we always had dental separate from medical, but your tooth just is not a steel pole in concrete. It is a tooth that sits in a ligament. It's vascular. It's in your mouth. It's connected to your body. And good oral health, good systemic health starts with good oral health. And so when a gum infection occurs, that's a direct line of infection into your body. So you want to make very sure that your oral health, your gum, your teeth, your breath, are all taken care of on a daily basis.
How important are routine cleanings, and how often is a routine cleaning? Is it every 4 months? Is it every 6 months? And especially for children?
Well, especially for children. Early on, you want to introduce your child to the office very early by cleaning their gums with a soft brush and a soft toothbrush, bristle brush, or a soft warm rag. But when you say how frequent or how important are the routine visits, they're extremely important, depending on your needs. If you have active gum disease or you're stabilized with gum disease, you need to get to the office every 3 months for those routine periodontal visits. But for the most part, it's every 6 months. And we want to catch things while they're small before they really flare up on us.
And, you know, we remember when we were kids, it was all the dark silver fillings. That's not the case anymore. But nowadays, even with kids, they're doing something new where they might not fill it right away. There's new techniques to kind of prevent the cavity from getting worse, right?
Well, let's focus on prevention here. Parents should consider fluoride treatments, which strengthens the tooth enamel and helps protect the teeth from decay, and sealants, which are plastic-like coatings applied kind of like nail polish to back teeth to help prevent them from decay. But for children with a significant number of cavities, silver diamine fluoride is a great option to discuss with your dentist. This type of treatment helps slow the progression of the cavity, but we do want these cavity filled. We also, silver diamine fluoride is also a very good option for older adults with a significant history of tooth decay.
And last but not least, in the last 30 seconds, TeleDentistry. I mean, you obviously can't get your tooth fixed through the computer, but you can get some really good advice.
Absolutely. Virtual care has become so very important as people are trying to avoid face-to-face interactions, and some dentists and dental plans are making telephone and video consultations available, also known as TeleDentistry.
Yeah.
But this option is only a starting point for care and advice to select an appropriate setting for in-person care. Dental care ranks among the most frequent and avoidable emergency room visits, so TeleDentistry helps people make their informed decisions as to where to go for in-person care, such as their own dentist, another available local dentist, and even their primary care physician.
Well, thank you so much,
Great
Doctor.
information there, Doctor.
We're both smiling. We don't know if you can see us, but we're smiling.
Call your dentist, make that appointment. Thank you.
Thank you for having us.
And for more information, you can go online to uhc.com for United Healthcare. And find United Healthcare also on social media at UHC.